Cancer is expensive, but there are key tips that may reduce your costs before and after you get medical care. While it is impossible to completely avoid out-of-pocket medical costs, taking the following 5 steps can help you avoid higher medical bills. Step 1. Make sure that you have adequate health insurance coverage that covers your healthcare providers and your prescription drugs. Review your health insurance coverage each year to make sure that you have the coverage that is best for you. Step 2. Talk to your healthcare team. They may have suggestions for reducing costs. For example, grouping your healthcare appointments together can help you avoid extra co-payments. Step 3. Check to see if your health insurance company requires you to get approval before you get medical care. This is also called pre-authorization. If you don't get approval, your health insurance company might deny coverage for treatments, testing, or prescription drugs. Your healthcare team may help you get the approval from your insurance company. Step 4. Use in-network providers if possible. Each insurance company contracts with specific healthcare providers and facilities that are considered in-network. Some PPO plans have limited coverage for out-of-network providers. Most HMO and EPO plans do not cover out-of-network providers at all. Step 5. Keep track of what you have paid out of pocket for medical care and compare it to your explanation of benefits, or EOB, from your insurance company. Mistakes happen, and you don't want to pay more than needed. For example, when you visit a provider, you may be asked to pay a copayment when you check in. If you have met your out-of-pocket maximum that includes copayments, you aren't responsible for paying any more copayments for the rest of your plan year. But your provider may not know that. The paperwork you get each time you receive medical care can be overwhelming, but there are 2 key pieces of information. From the health insurance company, you should get an explanation of benefits, or EOB, which details the claim received, how much your provider charged for the particular service, like an X-ray, what the health insurance company is going to pay your provider, and what you may owe your provider. This is called the patient responsibility. Usually, EOBs say, "This is not a bill," somewhere on the page. From the healthcare provider, you should get the bill with an amount that you are responsible for paying. You should wait to pay your provider until you receive the EOB to make sure they match and are correct. If you're concerned about missing the payment due date while waiting for your EOB, contact your provider and let them know that you are waiting for your EOB. When you get a medical bill, it's important to review it to make sure it's correct. Don't be afraid to ask your providers to explain codes or descriptions of services you received. Look for small errors like a wrong number or code, which can make a big difference in your bill. You might also be able to challenge certain charges, like procedures that were ordered and then canceled, medication ordered but never given to you, hospital errors, like lab results were lost, so the test had to be redone. Of course, dealing with medical bills can be a lot of work. If you need help, consider asking family and friends. They might be able to open mail, match EOBs to bills, and put payment due dates on your calendar. Reaching out to a case manager at your insurance company, or hiring a professional bill reviewer. If coverage for your medical care was denied by your insurance company, you may not have to accept their decision. If your insurance company says no, you can file an appeal and ask them to look at your situation again and change their decision. If you need to file an appeal, ask for help from your healthcare team. They may be able to file the appeal for you, or may give you information about why your medical care is necessary, which can help with your appeal. The key to managing medical bills is to get organized. There are lots of tools available to keep track of your medical bills, EOBs, medical records, and other paperwork related to your medical care. But the key is to use whichever tool is going to make it easier for you to stay organized, whether that is a box with file folders, a 3-ring binder, or electronic files. You should also keep track of any communications that you have with your provider and health insurance company. One reason it is important to stay organized is that tracking all of your expenses related to your medical and dental care could actually save you money. For example, Your medical and dental costs, including meals, lodging, and travel expenses related to medical care, might be tax deductible, which could lower your taxes or increase your refund. If you get a medical bill that you are unable to pay, it is important not to ignore it. Consider contacting your provider to ask for more time, or see if your provider will negotiate a payment plan or accept a lower lump sum payment. It is also important not to wait too long to contact your provider about an unpaid medical bill. Contacting your provider before unpaid bills get sent to collection agencies can help protect your credit score. Be careful when considering paying medical bills with credit cards. They usually have high interest rates, and you could end up spending more than necessary. You should also be careful when considering taking out a home loan to pay off medical debt. Using your home as collateral transfers the debt from being unsecured to secured, which means that the lender could take your home if you're unable to make payments. Consider applying for financial assistance programs to help pay your medical bills. For more information about managing medical bills and finances, visit triagecancer.org and cancerfinances.org.